I am Amani, as introduced. I work at Africa Academy for Public Health, and today I will be speaking on the co-occurrence of the different risk factors that affect or face adolescents across sub-Saharan Africa. This was a cross-continental study which included our colleagues in China and India. So I won't give so much background, as my the one who spoke before me has spoken much on what adolescents and that population face and who they are at this moment. But I would like to highlight that there are risk behaviors that face adolescents aged 10 to 19, and some of which are smoking, poor nutrition, alcohol consumption, and physical inactivity, and some of which Honorable Minister touched upon earlier today. And in a slang language or a young language, we call them SNAP. So we'll be like, oh, SNAP. You know, that was a side joke. Scientists don't laugh a lot. So there has been evidence that show that there is increase in morbidity and mortality among adolescents in low and middle income countries. And as Professor Ayo put it well yesterday, this is a code word for us, Africa, Latin America, and Asia. So despite the long life that we expect adolescents to have in the future, these risk behaviors co-occur among this population of adolescents, and there has been evidence that has established that. So we set out to determine in our particular population how these risk behaviors, the SNAP, how do they co-occur in different age groups, in different genders, and in different socioeconomic statuses, such as having a job and things around that. So for the interest of time, I'll just move forward. Those are the countries that participated: the Burkina Faso, China, Ethiopia, India, Ghana, Nigeria, Tanzania. And we looked at different indicators in physical activity, poor dietary quality habits, using alcohol, smoking, and risky behaviors, risky sexual behaviors. I notice my numbers are tiny, really tiny, but I'll tell a story. So we had 3 clusters as presented here. The first cluster was typically not characterized with any risk factors of note, but the second cluster was observed to have almost all of them were physically inactive, but also the other character is that they had a high risk of poor dietary quality. But the third cluster had evidence to show that they were more exposed to using alcohol, and they were practicing risky sexual behaviors, but also they were involved in smoking. Now, comparing the second and the third cluster to the first cluster, you will see that females who are not in educational systems, but also who are not engaged in paid work, are most likely to be physically inactive. At the same time, are most likely to be to have a high risk of poor dietary quality. At the same time, you would also, comparing the third cluster and the first cluster, you observe that those who consume alcohol, those who participate in risky sexual behavior, and those who use cigarettes or smoke are in a category that is between 15 to 19 years, but also are most likely to be male. At the same time, most of them are not employed, and they live with other people besides their parents. So it could be a guardian, a grandmother, grandfather, so on and so forth. So you see there are different characteristics in these populations and what co-occurrence happens in these particular groups within the adolescents. So what does this mean? This means that there is co-occurrence, evidence is there, and it is significant. There was a significant clustering of these patterns of health risk behaviors among adolescents in Sub-Saharan Africa and China and India. So early life interventions, maybe in structures like schools that could be sustainable, are what we propose in order to promote healthy behaviors and also prevent occurrence of risky and healthy behaviors among these adolescents. As we all know, this is the foundation, and once behavior established at this stage, it's very hard to rectify in the future. So I would like to acknowledge our partners in the ARISE network, but also our partners in India and China. And if you take interest to scan the QR code, you may read more on this paper. Thank you so much.